The broadcast is now starting. All attendees are in listen-only mode.
Well, hello everyone and welcome to Question Lab. We're happy to have you here once again on this Tuesday evening as we discuss tonight's topic, which is Step 2 CK. Leading our discussion today is Dr. Paras Zakaria. He's going to introduce himself to you now. Paras.
Thank you, Sean. Hey guys, my name is Paras. I am in dermatology and I'm also an RX coach with USMLE-Rx. So I work one-on-one with students such as you guys to help prepare y'all for the USMLE Step 1 and Step 2 CK as well, which is ever so becoming more and more important. And that's actually what our Q Lab is on today. Happy to help lead today's session.
I know I mentioned RX Coach earlier. RX Coach is our one-on-one coaching and tutoring program. We'll talk more about that later, but what I want you to know for now is that the methodology we're going to use and employ tonight as we dissect these questions is similar to the methodology that we employ in our coaching sessions. So without any further ado, let's go ahead and get into our first question of the evening on the topic of Step 2 CK. As you can see, the answer choices are covered up. That is by design. We do that because we don't want the answer choices to guide or dictate your thought process. And we don't want you to see an answer choice that you might be unfamiliar with that may cause you to panic as you're trying to answer the question on test day. So I've gone ahead and removed those answer choices for you. After that, we'd like to begin with the lead-in. The lead-in is the last sentence of the question itself. And the reason we do that is because we want you to know what the test writer is asking, so that as you're reading the vignette, you can pick up on all those relevant clues the first time around and not have to reread that question and waste valuable time on test day. So let's take a look at that lead-in now. Which of the following would be the most appropriate next step in management of this patient? Which of the following would be the most appropriate next step in the management of this patient? After that, we'd like to ask our students how many steps they believe the question will require. So for example, a one-step question could be where you're asked for the diagnosis. An example of a two-step question is when you're asked for the treatment for a diagnosis. An example of a three-step question is when you're asked for the mechanism of action of a treatment for a diagnosis. So with those examples in mind, please take a moment to let us know in the question box how many steps you believe this question will require. Now, if you look at your GoToWebinar control panel, you will see a question box. You're welcome to ask questions there, and our panelists like Richard, Jeff, myself, and Paras will do our very best to try to answer your question for you this evening. All right, I see some responses coming in. Let's take a look at that vignette. A 21-year-old G0, P0 woman comes to the ED because of a 2-day history of bilateral lower abdominal pain and vaginal discharge. The pain is constant and is associated with nausea and occasional vaginal bleeding. She had an appendectomy at 6 years old. She is sexually active with her boyfriend and uses oral contraceptive pills. Her menses are regular, and she often has pelvic pain with her menstruation that improves with ibuprofen. Her temperature is 39.1 degrees Celsius or 102.4 Fahrenheit. Pulse is 98 per minute. Respiratory rate is 13 per minute, and blood pressure is 131/73. She has lower abdominal tenderness, especially in the right lower quadrant, with no rebound. Bimanual examination reveals right adnexal tenderness and purulent cervical discharge. Which of the following would be the most appropriate next step in the management of this patient? I want all of you to start thinking about the important clues in the vignette and lead-in as I hand it off to Paras.
Thank you, Sean. So what we're going to do is we're going to go ahead and show you what we think are the important clues in this vignette and the lead-in. Okay, so starting off, generally the first thing you're going to be given are demographics. In this case, we're told this is a 21-year-old woman, so automatically you want to take note of that. Now, sometimes they'll give you something right off the bat, just like they did here, G0, P0. You know, sometimes they'll tell you this is an alcoholic patient, and so when they give you some sort of social history or some sort of clue right off the bat with those demographics, oftentimes it's going to play a role in that question. So you want to make note of that. Then they usually tell you, why are they coming to the ER? Why are they seeing the physician? And in this case, it's because of lower abdominal pain and vaginal discharge. Okay, that's why she's coming to the ED. And sometimes, like in this question, they'll tell you how long it's been going on for. In this case, 2 days. So that gives you a sense of if this is more of an acute issue like this or more of a chronic issue. Okay. Now, anytime they tell you about pain, you want to talk about what kind of pain. You want to find out descriptors of the pain. What is it associated with? You want to find out medical history, medications she's taking. And in this case, we kind of highlighted that. She had an appendectomy, active, she takes OCPs. They give us some important vital signs, and then physical exam findings. Especially in step 2 CK, it's going to be very important to interpret those physical exam and imaging findings. Okay, so we kind of highlighted some of those that we think are important there. Now this question is asking us about the most appropriate next step in the management of this patient. Okay, so the most appropriate next step in management. So we've got a couple steps here. I think one, we've got to figure out what is going on with this patient. What's the condition? What are we grouping her as? And then 2, what do we do next for her? Okay, so a 2-step question most likely here. So let's go ahead and let's take a look at those answer choices. What we see here are 5 answer choices, and what we're going to do is we're going to start at the bottom and we're going to work our way up to the top. Okay, so we're going to start with answer choice E and work our way up to answer choice A. And the reason we do this is because a lot of times we'll see students who start at the top and they'll work their way down. And then sometimes they'll select something that they like without going through all the answer choices. So as a result, we recommend doing it this way to prevent yourself from biasing yourselves. So let's go ahead and let's do that now. Answer choice E, urine beta human chorionic gonadotropin test. D, pelvic ultrasonography. C, gram stain of discharge. B, diagnostic laparoscopy. And A, DNA probes for chlamydia trachomatis and Neisseria gonorrhea. So we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds.
Excellent. Thank you very much, Boris. The polls are open. The word gonorrhea got cut out of the answer choice A, so I'm sure you guys can put that together, but just for good measure, letting you know. Once again, we're going to wait until about 2/3 of you have responded. We're about halfway there so far. As always, we do have a raffle, and one of you will win a very valuable prize. So make sure you stick around until the end because you must be present to win. All right, a few more moments here. Let's take a look and see what you selected. So it was close. 35% of you selected urine beta human chorionic gonadotropin test, and 33% of you selected DNA probes for chlamydia and gonorrhea. So let's take a look and see what the correct answer is. And the correct answer is indeed E, and 35% of you got it right. So great job, everyone. Let me hand it off to Paris.
Thank you, Sean. Yes, great job, guys. This is a really nice example of a step 2 CK question and how it's important to figure out what do you need to do. Because remember, the vignette or the lead-in was asking us about the next step, okay? Not the diagnostic test that's best to confirm the diagnosis, but what do we need to do next when we're managing this patient, okay? So hopefully you guys picked up that this patient likely has pelvic inflammatory disease, okay? She has physical exam findings that strongly suggest an infection, okay? She's febrile, she has lower abdominal tenderness, especially in the right lower quadrant. There is purulent discharge as well. We know she is sexually active as well. All risk factors and signs of an infection, okay? Now this can be due to Neisseria gonorrhea or chlamydia trachomatis, okay? And this patient, as we see, has some pain with menstruation as well, and a lot of things that are consistent with an infection, okay? But you should always begin workup in patients who you suspect has PID with the pregnancy test, assessing for beta HCG, because you want to rule out a pregnancy. You want to rule out an ectopic pregnancy that could also present with right lower or left lower quadrant abdominal tenderness, okay? So you should first do that, and after that comes back negative, then you can treat them or further work them up for pelvic inflammatory disease. So a positive pregnancy test, if it were to come back positive, would completely change the diagnosis and the management. So the first thing we need to do is make sure this patient does not have an ectopic pregnancy. We would do that by checking a beta HCG, okay? Now the other answer choice is pelvic ultrasound. That would be done if there was concern for an abscess. A gram stain of a discharge would be useful if we were trying to diagnose, let's say, Neisseria gonorrhea. But again, not the first thing we'd want to do. A diagnostic laparoscopy is usually if we can't figure out what's going on. And answer choice A, that would be something to help confirm the diagnosis of pelvic inflammatory disease and help us start treatment. But again, we would first need to check a beta HCG. So a really nice step 2 CK question here that you guys picked up on. Great job on this first question.
Excellent. Thank you very much, Boris. Let's move on now to our second question of the evening. Boris, did you want to discuss the slide at all?
Oh yes, thank you, Sean. Yes, absolutely. So let's thank you for reminding me. So pelvic inflammatory disease, and this is kind of from a little snippet from the first aid for step 2 CK book. You can see there that it's associated with Neisseria gonorrhea and chlamydia trachomatis. Okay, and how it presents is very similar to our patient: lower abdominal pain, fever, menstrual disturbances, purulent cervical discharge, just like our patient had. Okay, and there are some things that the patient would have on physical exam. Tenderness in the lower quadrant, like we said, adnexal tenderness. But you can see there, kind of towards the bottom, you would want to order a beta HCG to rule out pregnancy. Okay, that's the third bullet point underneath diagnosis, ordering a beta HCG to rule out pregnancy. Now keep in mind, just as a helpful tip, some of the other things when you have pelvic pain that's very acute, some other things, a nice mnemonic there: appendicitis, a ruptured ovarian cyst, ovarian torsion, abscess, PID, and also ectopic pregnancy, which is why it's important to rule out HCG.
Excellent. Thank you, Boris. Our second question of the evening now. Once again, the answer choices have been removed. That is by design. And we'll begin with the lead-in. Which of the following language, motor, and social milestones are anticipatory guidance for what this child should have achieved by her next well-child visit in 3 months? So I'll give all of you a few moments here to respond in the question box and let us know how many steps you think this question will require. And then we'll begin with that vignette. All right, system responses coming in. Let's take a look at that vignette. A child is lying on her belly in her crib. She is a healthy and well-nourished child. She is the product of a normal pregnancy born at 38 weeks gestation without any complications. She is developmentally appropriate for her age and is able to hold her head up without support and roll side to side. As her mother reads a book to her, she smiles and coos. Her mother's friend picks her up from the crib. At first, she is content to lay in the lady's arms. However, she recognizes and reaches out for her father as he walks by. Which of the following language, motor, and social milestones are anticipatory guidance for what this child should have achieved by her next well-child visit in 3 months? Boris.
Thank you, Sean. So let's go ahead and show you what we think are the important clues in this vignette and this lead-in. So now we're dealing with more of a pediatrics question here, okay? And they're giving us some clues. And right off the bat, you know, we had when we had read that lead-in, we knew that we were talking about milestones. So we want to make a specific task of finding those milestones in those questions, anything that can help us figure out what milestones we're at and what they're talking about. So they tell us the child is lying on her belly, born at 38 weeks, she's healthy, no complications, appropriate for her age. And then they tell us some other things that she's able to do. She's able to hold her head up without support. She can roll to the side. She smiles and coos. She recognizes her father as he walks by, but also is content laying in the stranger's arms. So these are all things that you would need to pick up on to be able to say, hey, this child is meeting or not meeting her milestones, and most likely at a certain age, okay? So then they're asking us, what milestones will this child have achieved at the next visit in 3 months, okay? So I think one, we've got to figure out from this question, where is the child milestone-wise right now? And then in 3 months, what milestones should they have met in an additional 3 months? So I think we've got a 2-step question here. So let's go ahead and let's take a look at those answer choices. And so kind of just to clarify, one, we want to figure out where she's at right now, maybe what age she's at right now, based on what we're being given in the vignette. 2, in 3 months, what milestones should she have met at that point? Okay, so let's go ahead and let's take a look at those answer choices. E, walk unassisted, use the words mama and dada discriminately. Imitate others and use a mature pincer grasp. D, walk backwards, creep upstairs, scribble, build a 2-block tower and use 4 to 6 words. C, sit propped on hands, roll over and transfer a toy from hand to hand. B, lift her chin, have a tight grasp, follow to midline, make sounds other than crying and be startled by sound. And A, crawl, pull to a stand, use a pincer grasp, wave bye-bye and say mama dada. And because these are a little bit longer answer choices, we'll leave this up for a little while so they won't get cut off, and then we'll go ahead and open up that poll.
Well, thank you, Paros. We'll give you a couple more seconds here to take a look. I'm going to go ahead and open up that poll now. So E was walk unassisted, use the words mama and dada discriminately, imitate others, and use a mature pincer grasp. D, walk backward, creep upstairs, scribble, build a 2-block tower and use 4 to 6 words. C, sit propped on hands, roll over and transfer a toy from hand to hand. B, lift her chin, have a tight grasp, follow to midline, make sounds other than crying, and be startled by sound. And A, crawl, pull to a stand, use a pincer grasp, wave bye-bye, and say mama dada. See the responses coming in. We'll give all of you a few more moments. All right, well, let's take a look and see what you selected. Looks like there was a clear favorite. That was answer choice C, sit propped on hands, roll over, and transfer a toy from hand to hand. So let's take a look and see what the correct answer is. And the correct answer is C, so well done, everybody. More than half of you got it right. Let me hand it off to Paros.
Thank you, Sean. Yes, great job with this question, guys. This is a really important topic in the pediatric step 2 material, knowing your milestones, knowing when a child has not met their milestones, what milestones you need to assess for at each of their well child checks, okay? So this patient, the first thing, like I said, is we need to figure out what age are they right now. If you notice, they didn't give us an age. They just said this is a child lying on her belly, okay? So we are told that she is able to roll to her side, hold her head up without support, smiles and coos, okay? So if we go to the next slide, this is a nice little table from first aid, and I would clarify that 2 months should say more 2 to 3 months, okay? And kind of like what our patient is, this patient is lifting her head, okay? She is cooing. She recognizes her parent, okay? So she's about 2 to 3 months in age. And so in 3 months, she's gonna be about 6 months, okay? So if we take a look at the third one, she's gonna be able to sit propped on her hands or sit unassisted, transfer objects or transfer a toy from hand to hand, roll over. So these are what you would see in 6 months, okay? At 9 months, 10 months, that's when they can start to crawl, that's when they can pull to stand, and they can use an immature pincer grasp. They can start saying mama dada, wave bye-bye, okay? Month 12 or 1 year, that's when they can walk. They can use a mature or 2-finger pincer grasp. They can say a couple words. They can follow one-step commands. So if we go back to our question and look at our answer choices, you could see that answer choice C is what she would be like in another 3 months. So 6 months, 3 plus 3 is 6. So at 6 months, she should be able to do answer choice C. Answer choice E, like we said, that is 12 months, what she would hopefully be meeting at 12 months. Answer choice D, that's actually a little bit further, so walking backwards, using a few words, that's 15 months of age. Answer choice B, this is something that you would expect at 1 month, so very early on in life, lifting the chin, following to midline, startled by sound. And answer choice A is what you'd expect at 9 months. So the best answer choice here, like you guys selected, is C.
Well, excellent. Thank you very much, Bars. Great job, everyone. Let's move now to a little discussion about RX code. So for those of you who are in med school right now and you're thinking, you know, I'm studying, but my results just don't match my efforts, or I don't know what I could be doing differently, or I feel like I'm just spinning my wheels, or you know what, I'm already doing really great, I just want to do better, right? Or I need somebody to help me make a study plan. I need to work on my test taking skills. I don't know what my strengths are. I don't know what my weaknesses are. Maybe somebody can help me point those out. And if you want help with any of those, that's what we do at RX Coach. We'll give you one of our assessments if you're studying for step 1. If you're studying for step 2, we'll have you take an assessment, and we'll evaluate that assessment to come up with a personalized study plan for you. You'll then meet with your tutor to go over subjects. They'll be able to identify your knowledge gaps and bridge them. We'll work on your test taking skills and make sure you have all the tools you need to succeed on not only step 1, but also on step 2, which is what we're talking about today. Because as you know, step 2 now is becoming more important than ever. And there's a lot riding on that one score. We want to make sure that you guys, that all of you are putting your best foot forward and getting the highest score possible so that you can get that residency you've been working so hard towards. So if you're interested in working with a coach to make sure you're maximizing your potential, make sure you're not leaving anything on the table, reach out to us at rx-coach or rx-coach.com so we can talk about the program and how it can benefit you. Once again, that's rx-coach or rx-coach.com. You can set up that free consultation to talk about the program and how it can benefit you. You know, we've been in medical education now for 30 years. We've authored our own resources, which we'll give you access to. And as a result of that, we have a lot of data and a lot of experience that can help you become more efficient with your studying and have a plan that sets you up for success. So we hope to hear from you if you're interested. Let's move on now to our third question of the evening. Once again, the answer choices are covered up, and we will begin with the lead-in. Which of the following is the most likely serious complication that can occur as a result of his long-term exposure? Which of the following is the most likely serious complication that can occur as a result of his long-term exposure? We'll give all of you a few moments here to respond to the question box and let us know how many steps you think this question will require, then we'll move on to that vignette. All right, give you a few more seconds here. All right, well, let's take a look at that vignette. A 46-year-old man comes to the clinic for an annual checkup, reporting headaches, dizziness, and palpitations. He works at an explosive factory and is concerned about his long-term exposure to industrial chemicals. His physical examination is normal. Laboratory studies show leukocyte count of 8,000, hematocrit 46%, hemoglobin 15, and platelets 310,000. He is found to have increased blood levels of an industrial agent. Which of the following is the most likely serious complication that can occur as a result of his long-term exposure? Far.
Thank you, Sean. So let's go ahead and talk about what we think are the important clues in this vignette and this lead-in, okay? So now we've got a 46-year-old male, okay? And he is coming in with a few important signs and symptoms: headaches, dizziness, and palpitations, okay? Now we can see this is a much shorter vignette than the last two, so any clues there are going to be very important. And they tell us that he works at an explosive factory, okay? We're given some lab findings there. We definitely want to make note of those, okay? Those might be important as to what's going on. They also tell us that he has increased blood levels of an industrial agent, okay? Now this question, however, is asking us about a serious complication that's most likely due to long-term exposure. So I think one, we've got to figure out what is the exposure here, and then two, what is a long-term serious side effect or complication to that exposure? So I think a nice two-step question here. So let's go ahead and let's take a look at those answer choices. And once again, we will start at the bottom and we will work our way up to the top. Answer choice E, tuberculosis. D, dementia. C, congestive heart failure. B, cardiac ischemia. And A, anemia. So once again, we're going to go ahead and open up that poll. Go ahead and select what you think is the best answer, and we'll talk about it in just a few seconds.
Excellent. Thank you, Parsons. The poll is open, and once again, we're going to wait until about 2/3 of you have responded. Remember that on test day, there is no penalty for guessing. So if you're unsure what the answer is, make sure you never leave a question blank. Just take your best guess. And then when you're studying on your own, like we're doing today, make sure you don't just review the correct answer choice. Make sure you also review the incorrect answer choices to ensure that you understood all of the concepts tested within that question. So we'll give all of you a few more moments here to submit your responses. All right, I see about half of you have selected a response so far. We'll give all of you a few more moments here. All right, let's take a look and see what you selected. Well, the favorite here with 43% was anemia, and second place with 25% we had cardiac ischemia. So let's see what the correct answer is. And the correct answer is B, cardiac ischemia, and 25% of you got it right. So challenging question indeed. Let's all pay attention to Paris as he breaks it down for us. Paris.
Thank you, Sean. Yes, definitely a challenging question. So let's take a look at what's going on here, okay? So this patient is having headaches, dizziness, and palpitations, and works at an explosive factory, okay? So he's most likely being exposed to nitrates at his job. These are common ingredients found in explosives factory. This patient likely also has what's called Monday disease, okay? And so what ends up happening is during the week, you're exposed to the nitrates at the explosive factory, and you kind of develop tolerance for it, okay? So during the work week, you don't really have the signs and symptoms. But then on the weekend, you go home and you're not at work for a couple days, so you're not exposed anymore. Then you come back on Monday and you're re-exposed to it, and then you start getting those signs and symptoms: headaches, tachycardia, dizziness, palpitations, okay? And that's kind of characteristic of a nitrates toxic ingestion. So let's go ahead and let's take a look at the next slide. And this is taking a look at our pharmacology section. So nitrates, okay? And you can see there some of those adverse effects: reflex tachycardia, hypotension, flushing headache, and then also Monday disease, where you have an industrial nitrate exposure. So you develop tolerance for the exposure during the work week, but then you lose that tolerance over the weekend. So you come back, and on Monday you develop tachycardia, dizziness, and headache, okay? Now what ends up happening is you get compensatory vasoconstriction in unopposed areas, okay? Now, normally, as we talked about, you would get vasodilation, but in some areas, to compensate, you get what's called compensatory vasoconstriction. And in areas where that happens, such as the heart, that can be bad. If you have coronary artery vasoconstriction, that can lead to cardiac ischemia, okay? So the most severe consequence of this vasodilation of nitrates exposure and vasodilation is compensatory vasoconstriction in other areas, and importantly, in critical areas such as the coronary vessels of the heart. And that can lead to cardiac ischemia, okay? So if we take a look at our question again and our answer choices, hopefully you guys are picking up how this industrial agent exposure was nitrates, and how long-term exposure to that can lead to compensatory vasoconstriction and thus potentially cardiac ischemia. The other answer choices are not side effects that you would see with nitrate exposure. Tuberculosis is maybe something if we were concerned about silica dust as the exposure here, but that's not the case. So the best answer choice here is answer choice B.
Well, thank you very much, Paras. Let's move on now to our last question of the evening before we move on to our raffle and special offer. So once again, the answer choices are covered up, and we will begin with the lead-in. Which of the following symptoms are most commonly associated with the patient's condition? Which of the following symptoms are most commonly associated with the patient's condition? Give all of you a few moments here to respond in the questions box and let us know how many steps you believe this question will require. All right, I see some responses coming in. Let's take a look at that vignette. A 30-year-old man presents to the ED with right-sided facial numbness and weakness that started a few hours ago. He reports a cough, recurrent fevers of 37.8 Celsius, and joint pain over the past few weeks. The joint pain started in his right knee but resolved on its own, but is now in both of his ankles. The cough is persistent and non-productive. He mentions that he went hiking last summer in Maine. He works in an office. On physical exam, temperature is 37.9 Celsius, 100.3 Fahrenheit. Blood pressure is 128/72. Heart rate is 64 per minute, and respiratory rate of 13 per minute. Neuro exam reveals intact speech with normal strength in all extremities. When asked to smile, his face appears as shown. Taste sensation is absent in the right anterior region of the tongue. There are tender erythematous nodules over his anterior shins. His ankles demonstrate soft tissue swelling and are painful to the touch. ECG reveals a right bundle branch block. Chest X-ray reveals hilar lymphadenopathy and lab work. Hemoglobin of 15, platelets of 200,000, leukocyte of 6,000, segmented neutrophils 56%, bands 3%, eosinophils 1%, lymphocytes 20%, sodium 140, potassium 4.2, chloride 100, calcium 10.9. Which of the following symptoms are most commonly associated with this patient's condition? Boris.
Thank you, Sean. So let's take a look at this question, okay? And we'll take a good look at this photograph here as well. And don't worry, we'll give you one more chance to take a look at this photo as well. But let's take a look at this. So this is, a much longer clinical vignette, something that you can see occasionally with your Step 2 CK questions, which are more clinical questions, okay? So we'll kind of show you what we think are the important clues in this vignette and the lead-in. And this is our 4th time doing that, so hopefully you guys are starting to get a sense of what clues are important to pick up on in these clinical and Step 2 CK questions, okay? So again, demographics, this is a 30-year-old male, and he's coming in because he's got right-sided facial numbness and weakness. And it started just a few hours ago, okay? Now they give us a lot of other pertinent positives, okay? They tell us about a cough, they tell us about fever, joint pains, okay? So anytime you're given a cough, you want to find out, was it productive, non-productive, was it acute, was it persistent? Travel history is important, vital signs are important, and again, as we talked about in Step 2, those physical exam findings are going to be very important, okay? They give us some neuro exam findings that are pertinent negatives, some normal things, but also some pertinent positives, some things that are abnormal. There's some dermatologic manifestations, and then we're given an EKG and chest X-ray. So a lot of things here going on, and we're going to have to try to piece all these clues together. But it's important that we pick up on those clues to begin with, okay? And then you can kind of go through the labs, and there are a lot of lab findings there, and you want to make sure that you're picking up on which ones are definitely abnormal, which ones can help you come to the correct answer here, okay? Now the question is asking us about not just the patient's condition, but what symptoms are commonly associated with the patient's condition. So I think we have a 2-step question here. 1, I think we need to figure out what is the patient's condition, and then 2, what symptoms are associated with that condition. So I think a 2-step question here, but I think it's going to be that first step, coming up with the patient's condition, is going to be very, it might be a little bit challenging. There are a lot of things here that we need to kind of sort through, okay? So let's go ahead and let's take a look at those answer choices. And once again, we're going to start at the bottom and work our way up to the top. Answer choice E, ulnar deviation and boutonniere deformity. D, muscular weakness and rash covering MCP joints bilaterally. C, erythema migrans. B, caseating granulomas. And A, anterior uveitis. Okay, so make sure you're taking a good look over this. Again, we'll go ahead and open up that poll. Go ahead and select what you think is the best answer here, and we'll talk about it in just a few seconds.
Well, thank you very much, Boris. This is our last question of the evening. Let's try to finish strong. I see the responses coming in. We'll give all of you a few more moments here. For those of you wondering, next week's topic is cardiac physiology. We hope to see you here. All right, a few more seconds here. Let's take a look and see what you selected. 49% of you selected erythema migrans, and that was by far the most popular choice. Let's take a look and see what the correct answer is. Correct answer is A, anterior uveitis, and 19% of you got it right. So definitely a challenging question. Let me hand it off to Boris.
Thank you, Sean. Yes, definitely a tough question here. And I can see why a lot of you guys picked answer choice C, okay? Erythema migrans. And I think, and we'll talk about that, but in a second. But first, let's talk about what's going on in this patient, okay? So this patient has a few things, right? This patient has a cough. This patient has fever, arthralgias, and facial nerve palsy, okay? Probably cranial nerve 7 palsy, okay? Now it's important that we also don't forget the imaging and labs. This patient has hilar lymphadenopathy and a high calcium, hypercalcemia. So this is concerning for sarcoidosis, okay? Now with sarcoidosis, you can also see erythema nodosum, where you get those red tender nodules on your anterior shins, okay? Let's take a look at the next slide. This is a little tidbit snapshot from first aid for step 2CK on sarcoidosis, okay? Now remember, these are non-caseating granulomas, okay? So the opposite of answer choice B. And you can see very similar to our patient, can present with a fever, cough, arthritis, okay? You would see lymphadenopathy on chest x-ray, especially in the hilar areas. Okay. Other things, other findings, hypercalcemia like our patient, elevated serum ACE levels as well. And importantly, cranial nerve defects as well are other findings you can have, okay? And the reason is sarcoidosis, those granulomas can affect cranial nerves. They can affect any nerves. And of the cranial nerves, cranial nerve 7 is most common, which is why this patient probably has cranial nerve 7 palsy, okay? So it's important not just to assume that cranial nerve 7 palsy is because of Lyme disease infection, but what else could be causing it? And we need to piece together all those clues to come up with the diagnosis, okay? Now, if you take a look on the right side, other features of sarcoid, so granulomas, arthritis, uveitis. Patients with sarcoidosis can get anterior uveitis, erythema nodosum, okay? All things that our patient had, which is why answer choice A was the correct answer. This patient is at risk for anterior uveitis. If we go back to our question, let's take a look at some of the other answer choices. So answer choice E, that's talking about rheumatoid arthritis. Okay, I think a lot of you guys figured out that this is more than just rheumatoid arthritis. Answer choice D, that's getting most likely at dermatomyositis, where you have muscle weakness in the proximal muscles, rash near the eyes, rash on the joints of the fingers, rash on the upper trunk, not what we have here. This patient has normal strength in all extremities. Erythema migrans, which was the most commonly selected answer here, or highest selected answer, that is getting at Lyme disease, okay? And you can have cranial nerve 7 in Lyme disease, okay? We are told that this patient did travel to Maine, okay? But it doesn't explain the other clues. It doesn't explain the hilar lymphadenopathy, doesn't explain the erythema nodosum, okay? Doesn't explain the cough, and so there's some things here, and it doesn't explain the hypercalcemia as well. There are some things here that are not explained by Lyme disease, okay? And lastly, answer choice B, caseating granulomas, that's more of a tuberculosis infection. Sarcoidosis is more of a non-caseating disease, okay? So the best answer choice here is answer choice A, a really good clinical question. You guys did great on the questions overall today. I will hand it back to you, Sean.
Well, thank you very much, Paris, and thank you all for hard work today. We had some tough ones, but you guys pulled through. So if you want to review these questions on your own and make sure you've mastered these topics, feel free to make note of these QIDs, take a picture, take a screenshot, write it down. And you can simply type these QIDs into the RX search field and it'll pull that question right up for you so you can review it on your own. So I'll give all of you a few more moments here to make note of that. All right. As always, we encourage you to get social with us. If you haven't subscribed to our YouTube channel, I highly recommend you do that. All of our question lab videos are posted there, including the one from tonight. Once again, that's YouTube. Our YouTube link is right there. We're on Instagram. We're on Twitter. We have a blog, firstaidteam.com. I encourage you to take a look at that. A lot of great free advice there, great articles, good guidance, as well as announcements about upcoming events. And of course, if you want to work with the coach for step 1 or step 2, a shelf exam, whatever it may be, in-school exams, reach out to us at rx-coach.com. You know, oftentimes people wait too long to start studying and then they feel all that pressure because they're on a time crunch. So, you know, if you want to start early, get a head start, you know, let us help you out, right? So that's rx-coach.com.